June is Pride Month, and the latest national survey finds that LGBTQ plus youth, in particular, face significant mental health challenges and barriers. And here with us to discuss is Sweetser spokesperson Justin Chenette. Justin, thank you so much for being here. So talk to us about why this group in particular faces mental health challenges.
Well, according to the Trevor Project's national survey, 36% of LGBTQ plus youth considered suicide in the last year, 10% actually attempted. What we also see is 62% of this population face anxiety, high anxiety rates, and 44% of LGBTQ youth who wanted and needed mental health care and treatment didn't get access to it. And these numbers spike even more for those that identify as transgender or non-binary youth. So these numbers are a stark reminder that we need to pay attention and we need to lift up this community.
Let's talk about what the leading factors or the factors leading to these numbers.
So according to the survey, and this should probably be no surprise to folks, really the toxic political environment, some of the headlines related to the debates in our public policy debate around LGBTQ rights and trans youth absolutely are impacting this population. 90% of LGBTQ plus youth feel like this is creating a lot of stress and anxiety. It's weighing on them, right? If they're seeing this debate over their rights in the news, they're gonna feel that. 8 out of 10 of these youth feel like it's a direct threat to their own safety. So when you feel like your own physical safety is at risk, that's gonna exacerbate mental health challenges, absolutely, right? And so a big takeaway from this is acceptance can save lives. It dramatically reduces suicidality and suicide attempts.
8 out of 10, wow, that's pretty eye-opening.
Yeah.
And I know Sweetser has resources available for people who are struggling, and also you've done a lot of work trying to lower the barrier to access. Talk a little bit about that too.
So I love talking about 988. I think I would put a little caveat to this, that the federal government did remove the LGBTQ plus component of the 988 number last year. So 10% of the calls and texts into 988 were from LGBTQ plus youth. And so to remove that component to the 988 number is just another barrier to accessing mental health treatment. So I'm still a believer in it. I think we need to still promote the 988 number for this population. You'll be in touch with local providers like Sweetser who cares and will be supportive and will guide you through the treatment journey, but just know that that was removed. And of course, organizations like the Trevor Project on the national level do a national hotline, and it's almost on a peer level where you can have that mutual conversation and connection. So if you're part of the LGBTQ plus community, particularly youth, the Trevor Project is also a great resource with their hotline. So whether it's Sweetser, whether it's the Trevor Project, 988, there are resources available. Know that you're not alone in this journey.
I think that that's very key here in this situation. All right, Justin, thank you so much for joining us. We appreciate it.